Assalamu alaikum. My name is Muniba. I am clinical psychologist and behavior therapist working in Seven Senses CDC Vagan. So today the topic of my video is building tolerance to nail clipping. Nail clipping is one of the most common area of tolerance for children with autism. And to help them overcome this, they needed a thoroughly broken down plan. We need a long-term solution, and that is to build your child tolerance to nail clipping. In this video, we will use systematic desensitization technique, which is a type of behavior therapy. Now, what is systematic desensitization? Systematic desensitization is a graduated exposure therapy. In this, we gradually and slowly present any object in front of the child through he or she might have any phobia, any fear. And for this, we need some social material. The first step is communicate expectation. In this, we need social story, visual model, first and then. You present any social story in front of your child, but keep in mind your child will be able to understand the story. And the next step is visual model. You present any visuals, any card, any video or any model in front of your child. The next step is first and then. Show any play card or any reward to your child. Ask the child, first you have to do this, then I will give you this reward. And the next step is probing. Probing is an important area in systematic desensitization. Before desensitization, it's important to identify the main problem of the child. Some children tolerate with the sight of nail clipper and others not. So you have to identify the main problem of your child. Place nail clipper at the edge of the table or far away from your child and ask the child to see the nail clipper. Then gradually bring it closer to your child. And don't forget to give him muscle relaxation therapy during this process. Just squeeze his hands and give deep compression on the tips of the fingers to relax the child. The next step is start demonstrating nail clipping in front of your child. You can do it on any dummy or with your colleague. In this process, we can say like we are doing modeling. And ask the child to touch the nail clipper. Then the third step is practice. We will practice all the previous steps. A social story in front of your child. Show any visual models. First and then again practice. Not a one-day process. It will take time, 6 months, 8 months, or maybe a year. It depends on the situation and severity of the child problem. After step 3, that is practice, now again try to increase tolerance level to touch the nail clipper. Ask child to touch with only one finger and then give immediate reward. Then child will be able to touch the nail clipper with 2 fingers. Ask the child to touch nail clipper with 2 fingers, then 3 fingers, and so on. When your child will be able to touch nail clipper with all of the fingers, then ask the child to hold nail clipper in his hand. And when your child will be able to do this, give him reinforcement and again repeat all the previous steps. The next phase is where your child to get to tolerate with blades of the nail clipper. Start it 2 or 3 centimeters away from your child. Like this, you can ask him, cut your nails. And then gradually and slowly bring it closer to your child. And just touch on the tip of the finger. Don't cut his nail. Again, do this touch blade on the tip of the fingers. So if during this your child show any anxiety, any fear, again give him muscle relaxation therapy. Give him deep compression, squeeze his hands, and press his tips of the finger. Repeat it few times, and your child will be able to tolerate. Then clip only one nail of the finger and give reinforcement. Then again next day or day after, cut another nail of the child and give reinforcement. During all this process, don't forget to give him reinforcement, as reinforcement plays an important role. Ask the child to cut third nail, fourth nail, and the fifth nail. As I already mentioned, it's not a one-day process. It takes months or might be years. So be patient and give time to your child to overcome this issue. It's not a big deal for us, but for the children who might have phobia, who might have fear or anxiety, it will be a problem for them. So understand them. Again, give deep compression or muscle relaxation therapy to your child and then cut his nails. So now, finally, a big day for you and your child. And your child will be able to cut all the nails. Again, do all the previous steps. If during this child show any anxiety, repeat all the previous steps, that will be step 2, step 3, bobbing and practice, and cut his nails. Soon he will be able to tolerate with nail clipping. Again, do all the previous steps gradually. It will take time, but this issue will be overcome. Hope so you like my video. Thank you.